Hello, my name is Serena Johnson. I am the lead practitioner and owner of the Psychosocial Boutique PLLC, as well as the creator of the Serene Ambition blog and brand. May is Mental Health Awareness Month, and we've been celebrating all month by providing resources, tips, and information to end the stigma and silence the shame of mental health versus mental illness. This is the first topic that I would like to discuss because most people do not know the difference between mental health and mental illness. So let's get to it. Mental health is associated with being physically healthy, overall well, versus mental illness, which can be associated with being sick or having disorder. Most people do not discuss mental health or mental illness because they do not know the difference and do not understand the levels of mental health versus mental illness. So what I like to do is associate being healthy with mental health. So you eat healthy, you are physically active, you are taking your prescribed medications, you are in touch with your doctors, primary physicians, all of that good stuff. You're taking care of yourself. You're healthy. So mental health is the same thing. You are performing self-care regimens, you're using your coping mechanisms, you are balanced, you have boundaries, you understand time management, you understand your triggers, you're good. Mental illness is when you're suffering from all the adverse symptoms of a disorder. You are not in touch with your triggers, your stressors. You may need medication, you may need treatment, you may need to reevaluate some things in life. That is mental illness. If you are suffering from a mental illness, do not be afraid to talk about it. More and more celebrities, athletes, everyday people, your friends and family are becoming more and more comfortable with seeing things on social media, television, movies that are discussing the way people suffer from mental illnesses. So feel free to share. We all have issues. We just got to learn how to deal with them. So feel free to reach out to your local physician by searching online directories like Psychology Today, Therapy for Black Girls. Your local National Alliance on Mental Illness is a good resource for services, low-income free services. Just search online for help. There are text lines, crisis lines. There are various resources. If you are in the Memphis area or the North Mississippi area, you can contact me. You can find me on social media. I'm pretty much available everywhere, so do not continue to suffer in silence. Find a good support system that you can confide in someone with about what you're going through. If you like to journal, those are ways to cope with your mental illness. Mental health, that's what you're trying to achieve. So let's get on the road for wellness and get your mental health in check. I hope this helps. Thank you.